Welcome to Gyna for You. I am Mr. Bedoya Ronga, consultant gynecologist. Today we're going to talk about the 2 weeks wait referral. It can be very stressful thinking that your GP is referring you because of a suspected cancer. It is very important to try to remember that most of the patients we see do not have cancer. The aim of this pathway is to ensure the prompt assessment and review of any potential cancer. In gynecology, the cancers can be from the vulva, vagina, cervix, uterus, and ovaries. Vulval cancer. Cancer of the vulva may be suspected when there is a sudden vulval lesion. It can be a lump, can be an ulcer, a bleeding area. There are 1,300 new cases per year and is among the 20th most common cancers. It represents less than 1% of the total cancers in women and affects mainly women of older age. Women over 75 represents 44% of the cases. Vaginal cancer is the less common of all the gynecological cancers. The symptoms that can raise concern is the apparition of a mass on the vaginal area. There are 250 new cases per year. It's not within the 20 most common cancers and represents less than 1% of the new gynecological cancers. It is more common in women over 75, representing 38%. Cervical cancer. Red flags for cervical cancers are postcoital bleeding, in the absence of a sexually transmitted infection, or when there is an abnormality in the cervix that can be seen with the naked eye. There are around 3,200 new cases of cervical cancer per year. It's the 14th most common gynecological cancer. Represents less than 2% of all the new cancers in the UK. Represents less than 2% of the new cancers in women in the UK. This is more common in younger women, being the peak women's age between 30 to 34. Uterine cancer. Uterine cancer symptoms is typically postmenopausal bleeding, which means that you experience bleeding 1 year after you have had your last menstrual period. Typically, we're talking of women over 50. Occasionally, menopausal can happen early or a bit later. Another symptom that endometrial cancer can give is persistent vaginal discharge in the absence of sexually transmitted infection. There are 9,400 new cases in the UK every year, and is the 4th most common cancer among women. It represents 5% of all the new cancers in women in the UK. The group age more affected are 75 to 79 years old, but mainly affects postmenopausal women. Ovarian cancer. Ovarian cancer symptoms are variable. Sometimes a lump can be felt in the abdomen. Other time, symptoms can be the sensation of fullness, the loss of appetite, pressure on the bladder from this lump with urinary frequency, the feeling of being bloated, also new onset of irritable bowel syndrome symptoms after the age of 50. There are 7,400 new cases of ovarian cancer in the UK every year. It is the sixth most common cancer and represents 4% of all new cancer in women. The group of people most affected are women over 75, which represent 28% of the cases. Once your GP has referred you to us, we will endeavour to see you within 2 weeks. At the Gynecological Consultation, we will ask you specific questions. We would like to know how long the symptoms have been bothering you. We would like to check that there is no sexually transmitted infection, that your smears are up to date, and we will have to proceed with an examination, checking the tummy and checking down below. Sometimes we will take a biopsy of the skin of the vulva or the cervix or the lining of the womb. Further investigations are ultrasound scan to check for thickening of the lining of the womb and ovarian abnormalities. Also, when we're trying to check for the lining of the womb, we may organize a hysteroscopy, a camera inside of the womb. This can be done as an outpatient, sometimes on the same visit, other times as an inpatient under anesthesia. Most of the time, after the consultation, you'll be reassured and may need to wait for 1 or 2 results that should be undertaken again within the 2 weeks wait. If you are confirmed of cancer, you will be referred to the gynecologist, who will discuss your case in a multidisciplinary team and offer you all the support of our specialized nurses and planning the treatment for you. But remember, most of the time, the outcome of the consultation is reassurance. I hope this video is being useful. Please write your comments. Thank you.